Hey everybody, it's Mike Ricciuto from Physical Therapy Now. I wanted to talk briefly about rotator cuff problems and rotator cuff pain and shoulder pain, which is a big topic that we always have questions, people asking us, when I put my arm up, it hurts, what's wrong with my shoulder? It used to work well and now it doesn't. And it can be a little bit of a complicated issue. And when people come in, I always tell people that, they're like a snowflake. No two snowflakes are the same. And even if you have the same problem with your shoulder, maybe it's a rotator cuff injury versus frozen shoulder or something else, the problem is going to be that you're completely different than your neighbor. You have a different history, you have a different medical history, you've done things in the past that were different than someone else. So you're going to have a different approach. We're going to have a different approach to each individual. And the severity of the pain does not always determine how bad your problem is. So there are 5 things usually that are wrong with the shoulder that make it difficult to diagnose, especially with an MRI or with an X-ray. Sometimes these things don't always precipitate and lead to pain or problems. I always tell people that imaging is part of the process or part of the puzzle that you're trying to solve. And it doesn't exclude the need for a really good exam and follow up with professionals. So the first thing I want to talk about is something that doesn't quite show up is rotator cuff weakness. And rotator cuff weakness is one of those things where the ball is not being held into the joint well enough, so it can actually pinch off structures. It can be torn. It moves within a pathway where there's a lot of bony ends, and so it's prone to injury if it's not strong. So that's one reason why someone might have shoulder pain. It also can precipitate pain far away from the actual site where you're having a problem. So that's another difficult type of thing. Second is scapular instability. There are 4 joints of the shoulder, and the scapula is that big wing blade on your back. And when that's not moving correctly, along with the other 4 joints of the shoulder in a great biomechanical way, then you also can pinch off structures, you can have things torn, and you can create pain points onto structures that don't normally take stress. The third thing is posture. If you're sitting at a desk all day with the rolled shoulders, forward head posture, you're going to be prone to shoulder pain. You're just out of anatomical alignment, and with forward shoulders, with your pecs being tight, back being weak, will end up once again creating pain in your shoulder that needs to be addressed professionally. The fourth item is overuse syndrome, and that means, and you've heard of this before with pitchers who are, they just keep throwing forward and forward and forward. They develop musculature on the front side of their body that pulls them tight, pulls them forward, almost like the poor posture. And then there are, swimmers, same type of issue. So any sports performance, and even if you're not playing in sports, if you're sitting at a desk, these things can happen if you have poor posture. So you'll develop overuse syndromes where you're using too many muscle groups and they're not counterbalanced by the other muscle groups. The fifth reason why someone might have shoulder pain and rotator cuff problems are actually not even related to the shoulder at all. It's related to the cervical spine. There are many nerves that run down through the spine and out of these canals that we have in our spine that cross over the shoulder and go into the elbow and the hand. Well, sometimes a shoulder injury is not at all a shoulder injury, and it's more of a cervical spine injury. So that's something that needs to be assessed before you even go into thinking that something's a shoulder injury. So there's your top 5 things and 5 reasons why shoulder pain might happen. And if there's any problems with this, you can contact us at 412-794-8352. And once again, I'm Mike Ricciuto with Physical Therapy Now. Thanks.